Welcome to Dr. Imran's official. Today we will discuss about ACL injury. An ACL injury, or anterior cruciate ligament injury, is a common knee injury, typically caused by sudden stops, changes in direction, or direct trauma to the knee. Here's some key information. 1. Anatomy asterisk. The ACL is one of the major ligaments in the knee joint, connecting the thigh bone femur to the shin bone tibia. It plays a crucial role in stabilizing the knee during movements. 2. Injury causes asterisk. ACL injuries often occur during sports activities that involve pivoting, jumping, or sudden deceleration. It can also result from accidents or falls. 3. Symptoms asterisk. Common symptoms include pain, swelling, instability, and a popping sensation at the time of injury. Some people may experience difficulty bearing weight on the affected leg. 4. Diagnosis asterisk. Doctors typically diagnose ACL injuries through a physical examination, medical history, and imaging tests like MRI. 5. Treatment asterisk. Treatment options depend on the severity of the injury and individual factors. They may include conservative treatment asterisk. For partial tears or mild injuries, rest, physical therapy, and bracing may be sufficient. Surgery asterisk. Full tears or severe injuries often require surgical reconstruction of the ACL using a graft, usually from the patient's own hamstring or patellar tendon. 6. Recovery asterisk. Recovery time varies but can take several months to return to sports or physical activities. Rehabilitation and strengthening exercises are crucial for a successful recovery. 7. Prevention asterisk. Exercises to strengthen the muscles around the knee, proper technique, and using protective gear can help reduce the risk of ACL injuries. 8. Long-term impact asterisk. If not properly treated or rehabilitated, ACL injuries can lead to chronic knee instability and an increased risk of osteoarthritis in the knee joint. It's essential to consult with a healthcare professional for an accurate diagnosis and appropriate treatment if you suspect an ACL injury.